Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest who's in the healthcare profession, and we talk about different issues, programs, information that I think will be of interest to you and your family. So stay tuned. We'll be back right after these messages with another exciting guest. Welcome back to Your Health Matters. My guest today is Kurt Manley, who's a physician assistant here at Kingman Regional Medical Center. Thanks for being on the show, Kurt.
You're welcome. Thanks for having me.
It's so great to have you on the program again.
Thank you.
You're always
Thank you.
filling in for me, and I appreciate that. But today
problem.
you're planned.
Yes, I am.
Planned
Yes,
to
I
have
was.
you on the schedule
Right.
today.
Right.
And we're here to talk about a bunch of stuff. But first off, we want to talk about Meadview, because that's the newest, greatest thing
Yes,
going
it
on
is.
in your life.
And it was such a cool opportunity, I think, for everybody involved. I mean, it was, the community had been without a provider for, I don't know, August or September, so it's been a little while, and they were, I wouldn't say frantic, because that's not a fair statement, but they were concerned because now they have nobody out there. And so the powers that be administration came to me and asked me if I would be interested in going out there one day a week. And
You stepped in.
well, yeah, well, I didn't think it was going to happen, and I didn't, to be real honest, I wasn't sure I was going to be as well received as I was, because the other person, to be fair, had been out there for a long time. And so they all knew her, they all loved her, and then things happened. But, you know, it was like, no, they loved me. They just said,
what's
it's fine.
not to love?
Well, I was going to say that, but, you know.
But, you know, and for Meadview, that is got to be a gift for them, because it's a long ways from Meadview to Kingman.
And it's inconvenient for them, because a lot of them, they're all on pretty much all fixed incomes, and they have their time set out that they come into town one day a week to do whatever it is that they need to do.
All their stuff, get it all done in one shop.
Right, and so now having a provider out there makes life a whole lot easier for them all the way around.
One less thing they have to do in town.
One more trip that they don't have to make. Because they normally do their trips on Saturday. Well, most doctors' offices aren't open on Saturday. Yeah, you know.
They have a life.
Sure.
So what other kinds of things you're seeing out in Meadview that, I mean, can anybody with any issue come to you?
Yes, pretty much. I mean, I've done a lot of referrals as far as from some specialty care, but they're high blood pressure, their diabetes, their high cholesterol, all of those things that are managed on a routine basis, as much as long-term medical issues can be routine, but that on that routine, go see, get a follow-up, make sure your blood levels are where they're supposed to be, and refill medications. And then, you know, some of the obscure things. You know, I've already done a couple suture jobs out there that just happen to be that day.
On the right day.
Right. So if you're working on your car, do it on Wednesday, so that way you make sure that if you get cut, you can come in and see me.
That's what I was just going to ask. What day? It's Wednesdays that you're there.
Wednesday is the day that I'm out there, and our first appointment is at 9 o'clock, and then we do appointments all the way up until 3:20, and it was our last appointment, and then as it gets busier, we do walk-ins also, and we'll do walk-ins up until 2. But for now, when we're not a totally full schedule, I'll take walk-ins all the way up to the end. It's, because it works for everybody.
Sure. So I was segue back. So you do sutures. That's easy for me to say.
Right.
Stitches.
Yes.
So you can handle those kind of emergency kind of things.
And I can, you know, some certain minor surgical procedures I can do. Depends upon what it is and where I fall into credentialing paperwork as far as that goes. And, you know, some of the stuff in an uncontrolled environment I don't really want to do out there anyway.
Yeah.
But, yeah, I can do that, and I can do all of the other things that I can do here in town. I have all of that access there, and so everything works out well for me.
That's awesome. And I imagine Dolan Springs as well, and maybe even White Hills, do they come?
You know, I haven't seen any Dolan Springs patients yet, but there was a patient just last week or the week before was telling her that her sister lives down at Dolan Springs. Could she come up? And I said, of course. So that. But that's still even closer to coming from Dolan Springs, right?
Sure.
So,
or Golden Valley, even.
Right.
I mean,
right. Exactly.
We have Golden Valley Medical Center.
Again, being that close to them makes life easy, and so they just readjust their schedule so they see their doctor on Wednesday.
Yeah, that works out really well. Right. Now, you're a physician assistant with Dr. Kevin Brown in Kingman. Is it Kingman
Family Practice?
And so you see the other 4 days?
No, I see patients with him, and I work 4 days a week, and I see patients in his office on Mondays and Tuesdays and Thursdays.
Oh, okay.
And then we follow up then.
Very good. And I know we've talked about, you've been on the show before, and we've talked about a physician assistant, what that means and what the difference is. But let's go over that again and refresh for people, because we have new viewers, new people in town, and I think it's important that people understand that they can see a physician assistant usually maybe faster, sooner, get in quicker than they can to see their regular primary.
The reality is, we have gotten away from we do everything that a doctor does, because that's not a fair statement, and it's not a true statement either. But what it really comes down to is that physician assistants were trained in a medical model. I mean, and there's a school here in Arizona, the NAU, that their first 2 semesters go with the medical school students from ASU and U of A. They all combine together and they do their basic anatomy all together.
Okay.
At a certain point at the end of certain classes, they go farther into medical school and they have that extra year of school, and then you have their rotations. Whereas as a PA goes through, they do 1 year of schooling or 1 year of rotations after they finish their didactic phase. So it's a much more compact. And the other thing is that we have to work under a doctor's license. Now, we are still licensed providers. We have to carry our own license here in the state of Arizona, or whatever state that you're working in. It doesn't really matter. And they have to go for both of that. And then, again, you have to have our own DEA numbers and all of our own provider identifications for insurance purposes so that we can bill accordingly. So
that makes sense.
Right.
Okay. So, but I guess my point is that we have a shortage of physicians, obviously, in Kingman.
Right, we do.
And it's always a challenge sometimes to get in to see your primary care physician.
Right.
So having a physician assistant makes it another option.
Right, and the thing that people, and there was recently, and I won't mention talk show host because it's a national talk show host that said, no. The other guy was saying that I don't want to see the medical school dropout because, and it's not that way. And this is
he was
because he was physician assistant or the
medical
medical school dropout. And
nice.
I thought, I said, well, this is obviously the American Academy of Physician Assistants is a shortcoming on their part, because they should do this huge marketing campaign that lets the entire world know. And there's a recent study, there's a recent study that shows that in 10 years, when the new medical conditions and the new medical programs come online, that we're going to be 58,000 primary care providers behind nationwide. Right. So
that's huge.
It's important that the American Academy and all of the state constituents put this huge, let everybody know what does a PA do, so that when you can't get in to see Dr. Brown. Okay, well then, Kurt's available? Okay, that's fine.
Yeah.
And it's not a case of that the reason that they don't want to see me is based on a personality thing, or they feel comfortable with him, not from an education standpoint.
Right,
so.
and that is important that they realize.
Hugely
that you
important.
Have that same education process, able to, for the most part, give that same level of care. And if you can't, you've got your physician
right, and that's the key thing, that with the doctor and the PA is a team event. I mean, we work very closely. I know all of his patients and he knows all of my patients. If he is going to see one, or if we get a lab result back that's out of whack for a patient, then we're going to know what to do with it, and say, hey, this is your patient, what have you done, what do you want me to do with him so far? Both of us do the same, and he defers to me, and he gives me the same respect, which makes us for a good team.
Absolutely.
So.
And collaboration, it's one of my favorite words right now in this time of my life.
Right.
And that is, I think everyone benefits when we collaborate, and that's what you're doing.
Right. And I mean, again, and it comes down to is that there are patients that would prefer to see him, and there are patients that prefer to see me. and neither one of us have a problem with, I don't want to see Kurt. Okay, I'm fine.
Yeah.
I'll just open up an appointment. We'll get somebody in that wants to see me. And
I'll throw a dart
and
at you later, but no. I'm just kidding.
So it's a good team approach because him and I get along so well, and we have that same mentality, and we have the same personality, and it helps a ton.
Absolutely, that's great. So when you see the patients in Meadview, do you sometimes send them down here to Kingman then?
If I need to send for specialty care, which I've had to, and then I will send them here to KRMC, is mainly because it just makes it easier to get them in, because it's always, to use your word, the collaboration. Works very well, and dependent upon the specialty in which I'm going to send them to, and who will be not the best for the job, but just does it more, in that respect, and who I'm going to send them to. But they prefer to come here, mainly because the biggest one is from an insurance standpoint, because they're in that network, and everything works really well.
Well, and you can share information easily that way too, right? Through our
and I've had some great support from the providers, from the specialty clinics that recognize that I'm out there, and that there's a need out there, and they say, hey, if you need anything here, call me. So that helps too. So it's because it's not that they're not have limited time, a limited availability, because it is inconvenient for them to come into town.
Well, and so often when it's inconvenient like that, they'll put things off.
Right, and it's always my standard question when somebody from a pharmaceutical rep comes in and tells me about this newest and greatest drug. I said, is it available and easy to get for the patient? Well, I'm not going to provide it then, because if it's hard to get, they won't take it. And it's just, if it's hard to get to the appointment, they won't go. So the other specialty clinics have been, and I don't want to name a bunch of them because I know I'll forget the ones that have also been helping, but they've all been very helpful and say, hey, just let me know what you need. I'll make sure my front desk people know. They're not getting in front of line, because that's not a fair statement, but they'll work with them from a scheduling standpoint to make things easier.
And I was just thinking, do you have a lab out there too?
We have the availability to draw labs. And we're working on the final stages of approval from a certification from CLIA and COA.
Because obviously that's going to be
huge as far as that goes, as far as that's a big inconvenience for a patient to come into town to do.
Well, and even for you then, you see a patient, you need lab work, they got to have a separate day, got to go into town, get that done, and then
they got to get the results back.
And it could be a couple of weeks before all that works together.
And that doesn't help either one of us, the patient or me, to make things work. So we're getting there.
Well, I'm proud of KRMC. I mean, I brag about us all the time, but the fact that we're reaching out to a community and identifying the need, and I know that I'd have to say the Meadview community reached out to us too, and said,
that's
hello,
true. Help us out.
We really need some help here, and we were able to provide that for them, and I know they're very appreciative of it as well. But a number of my guests recently on the show, we've been talking about the importance of catch it early, not just, although that's our catchphrase for our mammogram program, but it for all these diseases, the sooner we catch them and identify their issues, the better their outcomes.
It's a whole lot easier to treat, and we'll use diabetes as an example. It's a whole lot easier to treat diabetes when it's here than they come to me in 6 months, a year, 2 years, or whatever, and they go, I think I might have diabetes, but I'm not sure. Oh yeah, you do. And then they're on heavy dose medications to try to get it back down to where it was.
They're a manageable level, and probably on it. If it's gone too long, then it's damage has been done,
you're not going to do anything about it,
and you're going to have a permanent rest of your life kind of thing.
And then bad things can happen. And just the results of prolonged diabetics and uncontrolled diabetes is just terrible things. So, and that's one of the things we don't want.
We just had a testimonial from a patient who had diabetes and had fallen and had an injury, didn't heal, almost lost her limb, but then got referred to our wound care center, and using the hyperbaric treatment center and all of that, they were able to save her leg, and she was had wonderful things to say about how much it helped her and how grateful she was and all
Right,
of
it's
that.
a good thing, and that's also Dr. Brown. He also does.
Yes,
He's the
that's
hyperbaric
right,
medicine
that's
officer.
right.
You know,
Good.
which
I
is-
knew that.
Right, you knew that, and I was just reminding you of that. Right,
Thank you.
exactly.
Well, we're going to take a quick break, and then we'll come back, and maybe I can save myself in Dr. Brown's eyes.
Okay.
Thanks. I hope you'll join us after these messages. We'll be right back. If the numbers get big enough out in Meadview, would you look at expanding to a second date? Welcome back to Your Health Matters. My guest today is Kurt Manley. Thank you again for
You're
being on
very
the
welcome.
program.
I'm having a good time.
Thank you. Me too. I always enjoy having you on the program. We were talking before the break about Dr. Brown and the
Yes.
Wound Care Center,
Yes.
and I had forgotten, but I did know that once I delved into my brain file
Cells and
cabinet.
right.
I found that. Oh yeah, I did know
Right.
that Dr. Brown was the medical director for the
Right.
Wound Care Center, and so he sees a lot of those patients that I was talking about that have those.
He does, and that hyperbaric medicine, he brags about it not just because it's his, but because of what it does so much for a patient.
Yeah.
And it's nice to have that added bonus as a healthcare provider. For me, when I see a patient, and wow, this is something that they really need. And it's also nice as a collaboration that him and I have. I can call him in. I said, "Just be a good patient for that," and he go, "Oh yes." And that's nice to have that
Sure.
because none of the other PAs on staff have that quick. Can you take a quick
Yeah.
look? And I've
Yeah.
got that in my office
Right
all the
there.
time.
That's
Right.
nice. That is nice. Absolutely. Now, does he ever go out to Meadview with you?
No, he doesn't.
Yeah? Okay.
He's talked about it a couple of times that if the numbers presented that needed a follow-up from him, but because he's in the wound care, that means he's only in the office all day, Monday and Wednesday, so that would take away from. So we're not sure if that would, but we've talked about it.
Yeah.
It's been because he is my supervising physician there too. That just makes life
Sure.
easier from a legal standpoint,
Yeah.
administrative standpoint.
Yeah.
It just makes it easier. So.
So if the numbers get big enough out in Meadview, would you look at expanding to a second day, do you think?
It has been talked about that and asked that question, and that's and my answer then was, well, we're kind of theorizing ahead of our data because I mean the very first day we had 11 patients and we were just we had a false sense of security and we were all excited about it, and then it's it hasn't been that high, but we still get a lot of walk-ins. Our schedule is last week I had 5 on the schedule and I ended up seeing 8 because of walk-ins, and so it'll get there, and
Sure.
of course now the flu season has passed.
Yeah, it's
so that
winding
number
down.
will, and it's really, to be real honest, and I hope that they stay because you need at least a year for that continuous presence to be known. So-
Absolutely, and
so-
I was just thinking, since that is part of what I do, is communicating.
Right.
Try to.
Right.
And the importance of letting them know that
Right.
you're out there. And I
Right.
know that you and Dora have done a great job of being involved in the community and helping out at.
They've
their
been, I mean,
different
and I get a lot of kick because it's, my license plate on my car is Mr. Dora, and the number of people that know me as Mr. Dora far more than they know I walked into a room and they went, wow, you do this? No, this is the primary job. It's a lot of fun from that standpoint, and she was really instrumental in introducing me to key players out in Meadview.
Great.
To saying, hey, your new provider is my husband, and they invited me out to their community meeting, which is, I have to tell you, that is one of the coolest communities, is they're very involved.
I
They're-
I totally agree with you. I've been out there a couple of times.
Times.
I've never been to a community group that is that.
Right, and it is,
Cohesive.
they expect you to get involved. I
Right.
mean, and they, this was, I spoke to them in January, and they'd had all their Christmas functions, and they said, okay, who was there? And if everybody didn't raise their hand, they called them out and said, why not? Wow, and it was like, but it's cool to see that kind of involvement in a community that just, I mean, I don't know, 1,500 people, and they're all players.
Well, too, if you think about it, when you live that far out
Yes.
and you're in a smaller community, you do rely more heavily on your neighbors.
yes.
Now, I know, Marvin and
Absolutely.
I live out in Hackberry. We know our, quote, neighbors who
Right.
are a couple miles away better than when we lived in San Diego and our
Right,
next
and
door
your neighbors was right there. But,
yeah.
yeah, exactly.
You have that want or need to be more involved so that you
Exactly.
can call on them if you need
And
them.
it is a really large event center that for that size of community. It's like, wow,
Yeah,
That's
it's
very cool.
Yeah, and
So.
it, like you said, it's a close-knit group. They support each other well.
Very much so.
And I know they're very appreciative of having you out there. And I expect that as we get the word out more. And do they get a lot of the winter visitors that come there? I mean, does
A ton.
So the
They get
population goes down in the summer some?
Well, we noticed that they were one of the people from the chamber came by the other day and said that that there was people that were just now starting to leave from the winter visitor. So I don't know what the population wise is, but you also have the summer goes up because then you have the lake, and that where the problem was going to see is that from a medical office standpoint, we're still considered as a primary care, and that means that there's no medical care out there. If you're visiting, and we had this instance the other day that lady was visiting for a sister from out of town, but she came in because she probably had an ear infection based on the way she was explaining it. But we tried to get insurance to pay for it, her insurance had, but because we were listed as primary care, we couldn't see her unless she, unless she was willing to pay for it.
So it needed to be like a fast tracks
Yeah,
in
that
order
would kind
for
of have
her to be
that
able
dual,
to-
like Dr. Morgan did out in Golden Valley. He
Yeah.
had that Morgan Family Practice, urgent care, dual name on involved, and
Yeah.
that makes life a whole lot easier as far as
Interesting.
Yeah, so
Maybe something else
and it
we'll
has
have to
been-
look at
Yes,
down the road.
it has been addressed. It has been brought to the attention of the powers that be.
Very
Right,
good.
right. So from there, we don't know what's going to happen.
Yeah,
So
excellent. Well, and we'll have to make sure we get the word out to Dolan Springs and to
Yes.
White Hills. I mean, there's people in those communities as well. And actually, even going out Stockton Hill, you get out north,
Right.
at the north end, it's
Right.
closer for them to go to
there's a little
Meadview.
market going out Stockton Hill that it's almost that's the point of when you go out there a little ways. It's
Very
almost there that it's at the breaking point. Am I closer to going to town?
Yeah.
Or am I closer to go out to
to
Meadview?
Meadview.
That's it's. I mean, obviously at that point it's closer to coming to town, but there's
You get
the few
past that.
houses,
Yeah.
out past that,
Right.
and then it might be closer to go out. There's a flyer that goes out that lets people know, hey, not just. I mean, they're advertising, and they have this little newspaper, their flyer
Your Meadview
that goes
does
around. So it needs to be out there and more, and
Yeah.
it needs to get more because there's still people that don't know.
Sure. Yeah.
So
And it's a little hard to go door to door out in those communities because they're
right,
kind of
because you
long
could do
ways.
right. Yeah, you might get 3 houses if you're walking
Yeah.
it. Yeah, because it's a ways out there, and I've got a great staff that that has been assigned. Well, they were actually volunteered to come out and do Meadview
Great.
on one day, and my
So you've
friend
got like a carpool van? You
yeah,
ride
we all go out,
together?
we drive out, we leave here in the morning, and we get out there. It takes a little over an hour, gives us enough time. We get set up, and we get settled in and get everything done. And my front desk person is Julie Brewer. She's a float within KRMC, and when they sent out, she was the first person to volunteer. And then Modesta Ramirez is my MA, and she works at the resident clinic. So she comes out, and it was really cool for me to watch them take ownership of the clinic and putting things, where things are at that makes it easier from where it was set up before. And I said, this doesn't work for me. Okay.
Yeah.
I'm going to be asking you for it. Please put it where you
Yeah.
can find it right away. So, and they rearranged the lab, even though we're not there yet, but they rearranged the lab so
it's
that
ready.
when it's ready to go, all we need is a little piece of paper that says, I need the certification, and we're ready to go.
Excellent.
So yeah, we're working on it, and
Yeah.
it's a good team, and they enjoy it, and it's inconvenient for them to leave their regular job, but they're on board with it. And
That's awesome.
So
Well, and I think we want to make sure that the folks watching the program are aware that if they live out in that area, then they need, even if they're already seeing you, they need to make sure and tell their neighbors
Right,
and their
that they
friends
can come out
that
there
they can come, because it
and-
is important.
right.
That's, unfortunately, one of the things is we all know that you have to have patients to make it worthwhile
Right,
for that whole
exactly.
trip out there.
the more I have, and if I can, if I get, the way I see it, that I will get to where I'm seeing 10 to 15 scheduled appointments every day. I can see that happening without a real stretch, and then you take into the fact that there's going to be a few, the walk-ins, and during flu season I'll have a ton of those.
Sure.
Because
yeah.
and being able to take them is going to make life easy, because you don't know if you're going to wake up and be sick that day.
Yeah.
Right.
It's hard to plan
Yeah, it's a
that.
good day to be sick. It's
Yeah.
Wednesday.
I'll mark that on my calendar.
Right.
Wednesday.
Yeah, these are the
My
only
sick
days that
day.
I can be sick, or just deal with it. It's Monday. I can just deal with it until Wednesday. I'm
Yeah.
good.
Yeah,
So-
but I think kind of segueing back again, talking about the importance of early detection, and
Yes.
for a lot of those folks, because it was so inconvenient for
Yes.
them to come in to Kingman, that most of the time they just put stuff off. You
Yes.
know, they know they've had issues, but you know what? I'm just not going to deal
Right,
with that.
and
this
now
week.
it makes life easier
Yeah.
because the availability is there.
Yeah.
So hopefully we'll catch a few things and make
Awesome.
things better.
Thank you for being on the show,
Well, thank
Kurt.
you for having me.
Yeah.
I really appreciate it.
And you folks in Meadview, if you're watching, call Kurt. All right.
Thank you.
Thank you for watching us, and I'll have another exciting guest in the program next week.